Hello, everyone. I'm Kelli Jaecks, breast cancer survivor, menopause survivor. And recently, many of you have been asking me questions about menopause. And, I wrote the book, Martinis in Menopause, Strategies, Science, and Sips that Empower Women to Beat the Hormone Groan. And the interesting thing is, I have been getting a lot of questions through email and private message, particularly women asking about intimate wellness or their sexual health during and after menopause. And so I thought I would put together this mini series, and I'm going to be interviewing three different doctors who will give us their perspective on the menopausal woman, and some of them will be talking about intimate wellness, and some will just be talking about different issues regarding menopause. So for my first guest on the video series, I have the renowned surgeon, Dr. Ronald Jaecks. And Dr. Jaecks is my wonderful, compassionate husband who has been with me on all of this journey. And I thought it would be really fun to hear a little bit about his perspective. So hello, Dr. Jaecks. Welcome.
Hello, Kelli Jaecks. It is nice to be your first guest.
Well, I'm happy to have you. And so I'm going to just talk you through a couple of questions because we would really like to hear your experience and we really value your opinion. First, could you tell us a little bit about your experience as a surgeon and the work that you did for your lifetime?
I just completed a 35-year career, a very rewarding career in general surgery. And right from the start, I took a special interest in cancer surgery, and more specifically, breast cancer surgery. My first position was in San Bernardino, California, where I ran a breast center where we specialized in breast health and specifically the treatment. My part was the surgery of breast cancer. And so I got a chance to, right from the start, participate in breast cancer surgery as well as reconstruction.
Wow, that is so interesting, isn't it? And then some years later, me, your wife, gets breast cancer. So I'm wondering if you could tell us a little bit about your experience with my breast cancer as the spouse, but also as a surgeon who had so much back knowledge about what was going on.
Again, right from the start of my career, I took a special interest in not only the surgery, but also risk reduction and even prevention of breast cancer and other cancers. So the first thing that I noticed is that these women, sometimes in a very young age, at a very young age, were immediately put into menopause. So I would outline with the women the best approach that we could figure out using complementary medicine as well as Western medicine and even the whole body-mind connection. So I had this experience to draw on when it came to you because as part of my practice, I would do a little section with each patient on getting through and thriving through the surgery and follow-up treatments, whether that be radiation and chemotherapy or all three for women with breast cancer. So when it came time for you to go through menopause the first time, I was incredibly impressed because of your meticulous record keeping and your drive to go through this process in a positive and a very uplifting way, actually. It was inspiring to watch you do that, and then to see you take that same drive and find the best approach for you, and then eventually through your book to help other women go through this experience in every woman's life.
Well, yes, but thank you for that. I did have a drive to figure out what was going on and to find different treatment modalities, but there were times you knew your wife was in menopause, right?
Oh yes, I had experience with patients, and then 24/7 with you and your interaction with the family and the interface there. So I think that hopefully I was able to help you with that aspect too, and not just the medical stuff.
Well, yes, you did. But, and I'm grateful for you. But I would really like you to talk to the audience about, I wrote this book about menopause when I went through menopause as my natural aging as a woman reaching my early 50s at that time. And, but when I had the breast cancer diagnosis, as you know, I was on very low dose of hormone replacement therapy. And so if you would explain to the audience what you mean when you say that your wife has been through menopause 3 times.
Well, the first time was, as you said, the natural, and that was about 10 years leading up to the actual time when you had no period for a year plus. But that time period leading up, we got a chance to experience that together as a family. And that was it's a very natural process, and deserve a lot of praise for how you performed during that period. And then the November 20 of 2019, when you got the diagnosis of multifocal, multicentric, estrogen receptor and progesterone receptor positive cancer, that you were immediately taken off your really nice formulation of low dose bioidentical hormone replacement therapy. And you were taken off that suddenly that day. You couldn't take any more after you got the diagnosis.
Right.
So that kicked you into another menopause. And you, had a lot of other things to think about, diagnosis, this new diagnosis, and then treatment, which was complicated in your case as far as surgical treatment. And so that process up until the surgery, the bilateral mastectomies with reconstruction, until you were healed up from that, then you were off your hormone replacement therapy, so zero hormones. However,
Right.
your body is still producing a little bit of female hormone, as you know, and but as soon as they finished with your treatment, then they put you on the hormone anti-estrogen hormone blocker.
Yes.
And so the most common one is tamoxifen. You were on anastrozole,
Yeah.
though, Arimidex, and that one blocks out any of this hormone that your body is trying to produce still, and in the adrenal glands and the fat cells. And so that gets completely blocked again, putting you into your
Third.
menopause number 3.
Yes.
And so that's when everything's blocked. And I think that in some respects, because of some of the other side effects that are associated with these anti-estrogens, the Arimidex, which you were on, and because of some of those side effects, that actually your symptoms with this menopause were in some ways kind of more abrupt and more severe for you. So that's one of the ones I really felt for you on this one. And again, you use the same strategy, research, find out what you can do to prevent and treat some of these side effects of this menopause number 3.
Right. Yes. Thank you. You heard that right, everyone. I have been through menopause 3 times. And my dear husband has been along with me. I will say that when I had to abruptly leave my hormone replacement therapy in November with my breast cancer diagnosis, that second menopause threw me into, I was all of a sudden severely hot flashing again. I was having that irritation where I couldn't hold on to my emotions very well. Um, and it was quite debilitating. So much so that as soon as I saw a medical oncologist in January, they put me on a very, very low dose of what's it called, Lovey?
Antidepressant?
Yeah, very, very low dose of an antidepressant to bring the hormones into line, actually to balance the hot flashes. And so I, during my natural menopause transition that you read about in my book, which is full of tips and strategies of how to deal with hot flashes, how to deal with brain fog, how to deal with sexual health changes, how to deal with weight gain. That's all in my book. But this was the first time I went on a medication other than hormone replacement therapy to help manage my menopausal symptoms. And some women do need that to help manage their symptoms. And then again, as Dr. Jaecks alludes to, post surgery in February, once I healed up a few weeks from that, I had to go on these anti-estrogens, and that shoved me right into menopause again. And with that third menopause, I had more of the symptoms of the depression, the sadness, the low energy, the not wanting to get out of bed. And that all was because of the hormonal balance and imbalance in my body. So I'm more balanced now. I've had to have other medications and behavioral therapy. Uh, so I'm more stable now on this third round of menopause, wouldn't you say?
Absolutely. And you didn't mention one of the things that happened with the second and third menopause is the weight gain,
Yeah.
which, you again are a hero in my mind because you continued, even with recovery from surgery, do the best you could with diet and exercise. But even with your stringent approach to that, it still was a physiologic fact
Yeah.
that without estrogen, the weight came on for you.
Yeah. You're right. That was part of why I was for the depression and the sadness, because within a matter of what, 4 months, I gained 20 pounds, just bam. And any of you who know me, you know I work out very hard. I sweat, 5, 6 times a week. And Ron and I eat very clean, we eat organic, we eat very much plant-based diet. I do eat meat, but very little. And it was just so weird and debilitating. And I had that slowly during the first natural menopause, but nothing like this at the second and third menopause. So with all of that, I am doing better and am being more balanced in my life. And I think I feel better and I have more energy, and the weight is coming off very, very slowly, but that's okay. Slow is okay. But I just so love having you here and your perspective, Ron. I know we could talk all day, and women and their partners would probably love to talk with you all day. I'm wondering if you could just wrap us up here by telling us what advice would you give to either the woman who is facing menopause or in menopause, and or her partner who is having to deal with her in her menopause.
Well, I would say as a man, let's talk about sex.
Yes, there's changes there. We're going to do a whole other series on that.
Okay, so that's what my advice would be to talk and about it with your spouse, and not just about sex, but that is important too, as you'll cover in some of the other visits with other physicians. But to talk so that you can, as a couple, be your advocate. To research things. You have a great example in the surgical treatment that you ended up choosing. It was something that neither one of us had thought about until a couple of weeks after the diagnosis.
Right.
So be your advocate, whether it be in the type of surgery that you end up choosing or other treatment, or in what you need to get to go through the menopause 1, 2, or maybe even in your case, and in many women with breast cancer, 3 times, to do your research like you did. You wrote down everything, you recorded everything, you analyzed, you searched, you consulted with both Western medicine and complementary medicine and bioidentical hormones. All the things you went through were so important for other women to go through, instead of like some patients of mine, they just say, well, do what you think is best. And it's always better if the physician listens and the patient and family advocate. So that's my main advice. Research, advocate, delve into it, and just like when you're doing a project on your house, you want to do what's best by doing your research.
Right. Great. Thank you so much, Dr. Jaecks. That's the message, ladies. We've got to be our own health advocates, get our spouses or our partners on board with us, because menopause affects the whole family. And your care and your treatment and getting through it to the best of your ability is very much possible. And that's always my message, is you're not alone. Let's talk about menopause. Let's talk about what we're going through, and look at it as a celebration of life, that we are moving through life. And with that, I would like to thank you, Dr. Jaecks, for joining us tonight, and say to everyone out there, please stay tuned and join me for the next video. Bye.